Hey everybody, Nettie Owens here, and today I've brought with me Allison de Paoli of Altique. Hello Allison, good to have you here. We're continuing the series of what businesses need to know right now, and today's topic is very relevant and perhaps one that you may be thinking about, but maybe not, and it's time to bring it to the forefront of your awareness. So Allison helps employers take control of their healthcare spend and get budgeting predictability. And the happy side effect of that is better access to high quality care and lower out-of-pocket costs for your employees. So welcome.
Thank you. Thank you for having me.
I'm actually really glad to have you, and I've been looking forward to this conversation. And in light of the turn of events that we're experiencing now, there's even more. There's just even more to ask and find out about, and it's just become more and more relevant. So I'm glad to have you on here. So we're going to be talking specifically about healthcare and healthcare claims. And my first question is really just about, what are businesses doing right now to pay attention to healthcare and healthcare claims? I mean, certainly there's got to be some effect with the pandemic. And on top of that, now we have unrest. And I'm just really curious, like, what should they be thinking about with regard to healthcare claims?
So I think the overriding question is always, what am I doing to control the frequency and severity of my claims? And larger employers have had that, or have had the capability to have that in hand for some time. But now smaller employers can look at that as well. And it all starts with data, right? And if you're a small employer and you're kind of, say you have 5 or 8 or 20 employees and you're fully insured and you're subject to community rating, your renewal is what your renewal is, right? That's just the way it is. It's designed to protect you, and sometimes it does, and other times it does not. It's why health insurance costs, an employer will look at it and go, but nobody here goes to the doctor. And it's an insane amount of money because it's community rating. So the key right now is to understand what you have going on, what claims you have going on. And this may be the time to look at some newer type services like direct primary care, or a health sharing arrangement, or a level self-funded plan. We do them down to 5 lives. So even as a small employer, if you look at your data, you can understand what your risk is and you can manage it, because you're going to get stuck with a whole lot of stuff that has nothing to do with you.
Okay, so if you look at your data and you have questions about it, where's the best place to turn for more information?
So you need to get your data. So ask your advisor for your data. There are a couple of different choices there. If you run into any question, if you run into a challenge, I know you're going to throw my website up. You can contact me that way, and we can talk about things that you can do, and so that you can make good decisions moving forward. But data is always the first step, and it is, even in 2020, it is the most challenging step.
We've talked about data on other interviews like this, and it's interesting because we've moved to having more data accessible if it's being collected, if it's being, and if you're accessing it. So there's more pieces to that puzzle than just, okay, data, we need to be.
Absolutely. And you need to check for the data.
So what are people doing to control that frequency and severity of their claims, especially now? What can be done, or what do the employers need to do?
There are a few things. Most of them are non-traditional. So people who are early adopters generally tend to gravitate to them first, but many people have now heard of something called direct primary care.
Yeah, you mentioned that, and I actually didn't have a clue. I should have asked you then what that was.
So direct primary care is a physician or a group of physicians who have decided to exit the insurance arena. And what they do is they set up something that looks like a concierge practice.
I was about to ask, this sounds like concierge, and I've met several physicians. It's a great model.
It's a fabulous model, because what happens is the physician knows that in order to make a reasonable living, and we are talking about a reasonable living, we're not talking about a $3 million house, he needs so many patients. Right. And that's generally 400 to 600, maybe 800 patients. And he charges those patients a monthly fee.
Okay.
$50, $80, $100 a month, maybe $125 if you're on one of the coasts. That would be more typical. And he manages all of your care. So if you get the flu, if you need an annual checkup, if you sprain something, if you break something, that is going to be your first stop. You generally have 24-hour telephone and text messaging access. They do have direct primary care physicians that cover for them if they go away. So you still have that. And they charge a small copay when you go into the office for a visit, $10, $15, maybe $20, depending on where you are. That model can handle 80% of your medical need. If you get run over by a bus, if you have a cancer diagnosis, you do need health insurance on the back end of that.
But that becomes catastrophic insurance instead of just, everything day to day.
Yes. And they will generally, some DPC practices have a pharmacy in-house, and they will pass through prescriptions, usually cost plus 10%, which I think is fair. And some of them have x-ray in-house. Again, cost plus 10%. That seems fair. Some of them have an arrangement with an urgent care clinic or another facility to go get your x-rays done there. And they have also a cash pay arrangement.
So you're saying that you can set this up then for your employees. You can set up to support them in this way and then also support them perhaps with catastrophic care instead of some of the traditional plans. This sounds honestly awesome.
Absolutely. And you do have to find a physician you're like, right? That's a very personal relationship. I know several. I live in San Antonio. I know several. I have referred to all of them. And I notice different people gravitate towards different physicians, and that's fine, right? But most of the medical need is being taken care of right there. And when most of the medical need is being taken care of now, particularly if you have high blood pressure, if you have diabetes, if you have high cholesterol, those are easy things to control when they're controlled. When
think about, pulling all of these pieces together. Goodness, if you had this kind of care with the pandemic, you would have a lifeline immediately as you started to show symptoms, and treatment could be started much, much earlier instead of worrying to go into, an ER. And then also so much of what we're seeing as far as the unrest has to do with unfair, unequal treatment. And something like this would level the playing field where you could have support immediately so that diabetes and heart problems never become the big issue that they have for so many in our community. I know of several concierge physicians, and they're amazing. And I also know there are some national networks. So you do have the ability, to get access to a physician while you're traveling, and telemedicine becomes so much easier. I'm reminded of the interview we had last week with Dr. Ernesto Gutierrez, because he said, there's a lot of change that is going to be coming down the pike. This may be one of them, a greater move towards this kind of care.
It is. And telemedicine, it has exploded. There's not another word for it, but all of the models have exploded. There are several companies that do all of the telemedicine in the United States. You think there's 562. There's not. There's a small number that private label or white label for different organizations. And they are mostly all maxed out at this point and are having to change their pricing models because of how maxed out they are. And personally, I think that's a good problem to have, because it is effective care, it is cost-effective care, and it is care when it's needed. If that's 2 in the morning or 6 in the morning or 3 in the afternoon.
So these are the kinds of things that you could help somebody, a business owner, set up, give them more information about some of these alternatives if they reach out to you. I'm going to drop the link. We have some great comments in the feed as well. And just about access to telemedicine, finding a good doctor, which can be really, really challenging no matter what model you're following, and just the reality that chronic issues, when they're not dealt with, can truly cripple a family, and especially in the exorbitant costs that come with it. So such a powerful move that you can make for your employees and for yourself and for your business as far as cost savings. So if any of what we're talking about resonates or you have questions, I encourage you to reach out to Allison. The link is below, altique.com. And it's been so great to have you here.
Thank you for having me.